Hey guys, welcome to the Keystone Chiropractic Blogcast. I'm Dr. Jonathan Chung, and today we're going to be talking about hunchbacks. Now, when people think about hunchbacks, they're typically thinking about some old lady that's walking down the street, and you can see that their head is forward, that they have this exaggerated humping in their shoulders and their upper back, and this hunch is actually called a Dowager's hump. Now, for cases like this, especially if it's an elderly woman or an elderly adult, what's basically happened is Dowager's hump is historically when someone has osteoporosis and the vertebra actually collapse, and when the vertebra collapse, it creates this compensating poor postural formation. And in cases like that, there's not really too much you can do because there's not much you can do about a fractured vertebra. So there's limitations on how much you're able to fix and address that issue. But if you're watching this video, chances are that osteoporosis and a compression fracture isn't really your main issue. What you're mainly concerned about is some of the postural problems that are associated with that humping. Now, with that humping, we have to understand what the spine is supposed to look like. So the normal spine, we're actually supposed to have three curvatures when you look at the spine from the side. So the neck should have a curvature that's going like this, and the upper back will have a curvature that's going in the opposite direction, and then when you get back to the lower back, it'll have a curvature that looks like the neck. Now, these curves are there to allow for normal biomechanical function of the spine. It provides good support against gravity. And what happens when you have a postural problem that's creating that humping, typically you're seeing the neck come forward, and as the neck starts to come forward, you see an exaggerated appearance of the upper back curvatures. Now, when this happens, there are some things that people can do to address this. And a lot of it comes down to addressing some of the muscular dysfunction. Typically, it's associated with tight muscles in the shoulders and the chest, and it's also associated with weakness in the back muscles. What happens is when you get tightness in the chest and weakness in the back, your shoulders start to round, and then your head starts to push forward, creating a condition we call anterior head syndrome. And anterior head syndrome is associated with things like neck pain, degenerated discs, and a whole host of other problems. So if that's the situation, then certainly a structural chiropractic evaluation is something that should be considered. In other cases, a lot of times you could address some of these muscular dysfunctions by getting manual therapy against the chest and the shoulders and actually doing some corrective exercise to strengthen the back area. And that can actually help reduce some of that hunching and some of the forward head posture that you're seeing as the head starts to come forward. So certainly things like massage therapy can play a role, and exercise can play a role there. Now there's also situations where people will actually feel like there's kind of a spongy type structure on the back of their neck. In those cases, it's actually a fat pad that's sitting on the back of the vertebra, and as much as you correct your posture, there's not that much that you're actually going to be able to do about addressing that fatty pad. There may be some cosmetic surgery interventions that could be used for that, but that's a little bit out of my realm of knowledge. But if you are looking for a way to correct anterior head syndrome and some of this hunching that's going on in your back, then getting evaluated by a structural chiropractor may be a good place to start, because not only is it a cosmetic issue, but it is something that can create problems in the function of your spine and your nervous system as a whole, which can lead to a host of musculoskeletal problems and secondary conditions like headaches, neck pain, shoulder pain, and tightness throughout your body. So hope that answered some of your questions. If you have any questions, feel free to hit me up on Twitter at Dr. Jonathan Chung, or you could always hit the consultation button throughout their website, and you'll be able to find us there and ask us questions through email, or even schedule a live in-person consultation. We'll see you next time.